The following is an original production of AZPM News.
For Arizona Public Media, I'm Tim Swindle, Professor Emeritus of Planetary Science at the University of Arizona, and this is Arizona Science. Joining me today is Sairam Parthasarathy, the Chief of the Division of Pulmonary, Allergy, Critical Care, and Sleep Medicine at the University of Arizona Health Sciences. Welcome.
Thank you. Thanks for having me.
Sai, one of the things you've been studying is the effects of long COVID as one of the local leaders of a massive study called RECOVER. Could you explain a little bit about what the RECOVER initiative is and what your role in it has been?
Yeah, the RECOVER initiative, as you said, is a monumental effort to study the post-infectious complications of acute COVID. And it's called long COVID because the symptoms linger beyond 3 months. It could be one symptom or many symptoms that can be debilitating to people. And the effort includes various entities within the umbrella of the RECOVER initiative. I am part of one of them, which is the RECOVER Adult Cohort Study, which is an observational study of about 15,000 people with 15 hubs across the United States. Each one has spokes, so it has other sites. So that's about 83 sites that come under the 15 hubs that looks at adults with long COVID. Then there is the RECOVER Pediatrics cohort, which looks at the same thing in children. There was a pregnancy cohort that looked at it in pregnant women, and now that they have given birth to their children, the children go into the pediatric cohort and the moms remain in the cohort. There's an autopsy cohort where these are individuals, unfortunately, who passed away and donated their body for science, and that is looking at the postmortem findings of long COVID.
What are some of the most significant things we've learned from the RECOVER initiative?
Yeah, it's not too often that you get to define a new disease. When I went to medical school, there was no COVID and there was no long COVID. And so I was fortunate to be part of a writing committee that wrote how to define this condition. There are over 200 symptoms of long COVID. And out of those, there are some that feature prominently that are more associated with this long COVID condition. And they carry more weight. They carry more points. And so it's almost like a point system. And we had to do that not because it's the perfect definition, just like high blood pressure. What was high blood pressure 20 years ago is not high blood pressure now. That goalpost keeps moving as we do further research and we realize we're going lower and lower and lower just for blood pressure values. And same thing with diabetes, the hemoglobin A1C, we keep going lower and lower because we're finding that when we go low, there's more data now showing that there are people even below that mark that seem to suffer the long-term consequences of diabetes and the long-term consequences of blood pressure. So that bar is not going down just because. It's going down because more research by studies such as our observational cohort study was finding out that people above the threshold still suffer from more adverse effects than people further down on that scale. And so the idea of this definition was to make sure that we have a diagnosis that's slam dunk long COVID, that no one would dispute that they have long COVID. So I would say that's one of the first major contributions of the study, and there are many more.
What are the most common effects of long COVID?
The common effects, interestingly, are neurological. I'm a pulmonologist by background, but I also study sleep, which is, a function of the brain. And the brain is a fascinating organ because we're using it right now. And the fascinating thing about it, and unfortunate thing at the same time, is that the brain or nerve injury doesn't repair itself well. The most common symptoms are brain fog, fatigue, what we call post-exertional malaise, shortness of breath, lingering cough that doesn't seem to, go away. Of course, initially with what we call the Delta strain or the Alpha strain, sleep disturbances is another one. So these are the key, what we call score driving symptoms that linger after long COVID and therefore are not only more prevalent, they're more prominent, they're more debilitating because people have brain fog and they have cognitive impairment. They can't remember where they parked the car. I had a 40-year-old patient of mine tell me she's just 40. She goes to the grocery store, she comes out she does not know where she parked her car. And that should not be happening at the age of 40. And the fatigue can be mild, where, they find that they're not able to run that half a marathon that they used to do before. But it can be so severe that people are bedridden and have to be on disability. They're not able to hold a job.
Can a study this size of something like long COVID help us understand other diseases with similarly long lists of potential symptoms, but that can't be triggered to a specific event, such as chronic fatigue syndrome?
We're not looking at the heart doctor looking at the heart, or the lung doctor looking at the lungs, or the joint orthopedician looking at the joints. We're talking about a condition that can affect all of these in the entire body. How do they interact and how they're talking to each other will not only give us information about long COVID, it'll also give us insights about other conditions like Lyme disease, chronic fatigue syndrome. But it'll also tell us about chronic medical conditions. Why is it that someone with heart failure after a recent heart attack has depression? Now, is the depression purely by the basis of the fact that they are not able to do what they could do before? Or is there inflammation in the body, and the inflammation is affecting the nerves in the brain? And we all know that the reason for the depression is a chemical imbalance. So does that inflammation contribute to the chemical imbalance? And so it opens our mind's eye to be able to study a disease that affects every nook and cranny of the body. There are skin changes. There are nail changes. There is a COVID skin, where they would slough off areas of their skin when they have acute COVID and are on a ventilator. But then when you're talking about chronic, long-term, long COVID, they have other kinds of skin conditions that are going on, and not just the neuropathic symptoms. So it gives us a panoramic view of how the body talks to each other. We're able to understand certain new pathways in which how the disease can affect another organ that can give us insight into a condition that is just about that organ.
People are still getting COVID-19, although it's different variants than it was at the start of the pandemic, and many of the people now have had it before or have been vaccinated. Do you know anything about whether the incidence of long COVID has changed among people getting it?
Yeah, it has. One perfect example is, pre-Omicron strains were losing smell and taste, but not anymore, because those strains, like the Delta strain, was notoriously what we called, neurotropic. It was going and hunting down the nervous system. And also, there was a period of time when it was pre-vaccination. So we were sitting ducks. The milder the infection, the less likely we're going to have long COVID. The more severe the infection, more likely we're going to have long COVID. But that is not true for everybody. There are people who have just the sniffles from COVID, and then they can develop severe and significant and debilitating long COVID down the road. So the ability for us to really figure out why someone develops long COVID versus why someone doesn't develop long COVID is itself a question mark. And when someone develops long COVID, they're also more likely to get more COVID infections. Even last July, which is 2025, which is 5 years after the start of the acute COVID infection, to directly answer your question. Last July, in the summer, we had a new strain that was going around and that was causing new infections in people. And I was writing prescriptions for Paxlovid, for people going to the East Coast and coming back. And then it came to Arizona, not as much of a high wave here, but it most certainly was an effect on the East Coast. We were making new cases of long COVID from the infection of last July. So even to this date, even with prior infections being more neurotropic or toxic or more virulent, and prior to vaccination, people having more severe COVID, now post-vaccine discovery and vaccination, post-infection, people who are getting infections as late as last July are having symptoms lingering past 3 months.
Thanks for talking with us, Sai. Our guest today has been Sairam Parthasarathy, who has been leading the local part of a nationwide study of the effects of long COVID. This is Tim Swindle, and you have been listening to Arizona Science. You can hear more of this conversation and others on our Arizona Science segments by going to the AZPM podcasts at azpm.org.
This has been an original production of AZPM News.